It's Wednesday, March 17. This is the news on PBCJ. I'm Carol Francis. Now, how many doses of vaccine should the country expect over the next few months? Permanent Secretary in the Health and Wellness Ministry, Dunstan Brown, has given a supply projection. He was speaking at a Joint Select Committee meeting.
We would have noted in the public domain that we received our donation of 50,000, and yesterday we got the first installment of our COVAX allocation of 14,400. We have received notification from COVAX that we are to receive a second allocation from our allotment of 26,800. The anticipated delivery time for that is the first week of April. We have a discussion that has not yet been finalized, but the projections on this allocation through the private sector engagement with the NHF is that an allocation of 100,000 doses will be available in the second week of April. But then this is still about 70% guaranteed. The fourth installment of our supply side, or the fifth installment, is our projections from the African Medical Supply Platform of 500,000 doses of vaccine. We are still projected to receive that allocation in April. And then we have our allocation that is still being programmed in May for Moderna. And then the final allocation of 83,600 from our COVAX for this quarter is anticipated in the third week of May.
Mr. Bryan says 874,000 doses of vaccines are expected for this quarter. The figure represents a downward projection from the 974,000 initially projected. And as Jamaica and the rest of the world continues to battle the global COVID-19 pandemic, there is a search on for solutions. Vaccinations are ongoing, but there is misinformation, confusion, and even mistrust in some quarters over COVID-19 vaccines. One of several drugs being touted as an alternative treatment is Ivermectin. Ivermectin is an approved anti-parasitic drug that is used to treat both humans and animals with a broad spectrum of antiviral properties. Will this drug be made available in Jamaica? That was a question raised by opposition spokesman on health, Dr. Maurice Guy, at Tuesday's Parliamentary Joint Select Committee meeting.
Minister, you indicated last meeting, Dr. Williams indicated that there was not sufficient data on ivermectin yet. Just to find out whether there is any new data and whether the Ministry of Health and Wellness could have an update on that.
Chief Medical Officer Dr. Jacqueline Bisesa McKenzie says the ministry had concerns about the drug's safety.
We do not have a problem to register ivermectin for human use for the unlabeled uses, because that is well documented in terms of its safety, its efficacy, and how it is recommended for usage. So we recognize, of course, that seeing the data out there, many physicians would, because people are looking for methods to treat, and they want to offer something, and they would have seen the studies that they would, in discussion with their patients, would want to try this drug. So we have no problem to register the drug, and in our discussions with our Standards and Regulations Department, we have said that as soon as a request for registration of the drug comes in, we will expedite the process for registration so that the drug would be available in country. However, the recommendation for the registration is going to be for its unlabeled use. But we do know that as physicians, there are several drugs that we would have seen benefits, we would have seen small studies, and we would have utilized those drugs for off-label use with the consent of the patient and acceptance of responsibility. What there is that we don't have enough information on a policy level to say to the population that the benefits of this drug are clearly demonstrated and the dosage that is, pardon?
COVID-19.
For COVID-19, and that the dosage has been tested and has been found to be effective in the management. I just want to remind the team that the first study that came out that had introduced ivermectin was a study out of Australia, where in the laboratory, the ivermectin was found to have antiviral properties against COVID management. However, the dosage at which that was found to be effective to have the plasma level is a dose that has not been studied in human beings.
And the COVID-19 pandemic has dealt a body blow to Jamaica's economy. Some have lost their jobs, others their livelihoods, curtailed by necessary health protocols. Moreover, nearly 500 Jamaicans have lost their lives to the virus, on top of other recurring social ills, such as high homicide rates and crime. This scenario formed the backdrop for Mark Golding's maiden budget presentation as opposition leader. In his contribution to the 2021-2022 debate on Tuesday, he lambasted the government for what he called its timidity in repositioning Jamaica to meet the challenges of a post-COVID-19 world. We get more in this report.
The opposition leader said that the current global crisis also brought great opportunities.
Madam Speaker, this is therefore a time of immense danger for our country, but it can also be a time of great opportunity. We should use the lessons presented by this crisis to reset the status quo, rather than just yearning for a return to the ways of the past. We must identify new and better ways of tackling the challenges that impair our national progress. Only we, all of us together and united, can decide whether we learn from the crisis or we yield to the crisis as we face the future.
He called for the resumption of Vale Royal talks in the spirit of a bipartisan approach. He also lamented the government's move to remove chairmanship of some of the parliamentary oversight bodies from the opposition.
We therefore regret that the Vale Royal talks, commenced by our predecessors on both sides, have been laid to rest. Those meetings allowed the government and opposition to discuss important matters affecting our country and to develop a consensus where possible. In a similar vein, Madam Speaker, the removal of opposition members from chairing most of the parliamentary oversight committees after the 2020 general election was a retrograde step.
As to the government's proposed $830.8 billion for the 2021-2022 financial year, Mr. Golding said it was inadequate.
In the face of this devastating crisis on the people, the response of the government has, in our view, been timid and inadequate. The budget for the coming fiscal year only makes provision for $8 billion, which is less than half of 1% of GDP, in direct COVID-related social support for vulnerable Jamaicans. This is half of the amount provided in the last fiscal year now ending, which itself proved to be far too little. This budget, Madam Speaker, does not do right by the Jamaican people, especially the poor, those earning low wages, the unemployed, the elders struggling to survive on a meager NIS pension that has not been increased since 2018. And it is not just individuals who are struggling. Service industries, especially tourism, entertainment, transport, and sports, have been hit badly. In those sectors, businesses, both large and small, now have their backs to the wall.
Prime Minister Andrew Holness will make his contribution to the budget debate on Thursday, March 18. Melvin Pennant, PBCJ News.
Do you feel tired and helpless when you see piles of garbage on your street? in gullies or just outside your office? There is no longer a need to feel helpless. With a flick of the wrist and a click, you can take a picture and send it to the National Solid Waste Management Authority and get the garbage removed. Marlon Samuels has more in this report.
Approximately 1 kilogram of waste is produced per person per day in Jamaica. This amount is expected to increase by an average of 6% per year. A lot of the garbage ends up in gullies. At times, they are left lining the streets. Poor solid waste management practices are one of the most challenging environmental issues in Jamaica. To properly address the issue of Jamaica's solid waste collection services requires the use of technology. The National Solid Waste Management Authority, NSWMA, has come up with an innovative tool to manage Jamaica's waste collection services. They have created a mobile application to report instances of littering, illegal dumping, uncollected garbage while allowing the user to access waste management information at their fingertips. The custom-branded mobile app is easy to use and offers helpful information to users. The app also allows Jamaicans to communicate directly with them about garbage disposal and collection. Users can download the app by visiting the iOS or Android Play stores and type NSWMA. Users can upload images of garbage in a public space, littering and illegal dumping. Once the image is uploaded, the app sends a geotagger report to the NSWMA. The user will receive a reference number and is able to follow the progress of the case within the app. The app will go a long way in managing solid waste collection. Despite the app, some believe more must be done. They point to the need for more capital resources, public education, and enforcement of solid waste management legislation. For the news on PBCJ, I'm Marlon Samuels.
The deadline to register for the next voters list is Wednesday, March 31. Individuals who are already on the voters list should not reapply. Persons wanting to have their names added to the voters list must apply in person at any electoral office of Jamaica EOJ constituency office. If you miss the March 31 deadline, you will have to wait to be added to the November 30, 2021 list. Electors who meet the March 31 deadline should receive the voter identification card by mid-June. The EOJ is urging registered electors who have changed their address to visit the EOJ constituency office where they now live and apply for a transfer of registration. Tax Administration Jamaica TAJ is advising employers that the due date for filing the employer's annual return is Wednesday, March 31. Employers and/or their agents must register to do so. The return must be filed online using the tax portal at www.jamaicatax.gov.jm. The return must include the TRN and NIS for the employees listed. Now, do you consistently wake up in the morning feeling lethargic? Then you may be suffering from sleep apnea. This is a condition in which breathing repeatedly stops and starts. If you snore loudly and feel tired even after a full night's sleep, you might be suffering from sleep apnea. In today's Living Healthy report, Dr. Lawson Myers explores the whole issue of sleep apnea.
Hi, I'm HD. Welcome to another episode of HD's Jazz. Today I'm in the lovely Hope Gardens and I'm seated at one of the many benches that you'll see scattered throughout the garden. And we are going to be talking about today a new lease on life.
Hello! Today we're going to be making breakfast and preparing a lunchbox for school. Let's start with some sugar and salt. And wash it down with a nice big glass of more sugar. And now for the lunchbox. Let's put in saturated fat, more salt, and sugar. Foods high in salt, fats, and sugar increase the risk of hypertension, obesity, heart disease, and type 2 diabetes. Now more than ever, we have the right to know what's in our food. Give us warning labels on the front of our food packages.
Hi, Maisha.
Hi, Doc.
Listen, I am so glad that you are willing to come and share with me here at this Hope Garden. Did I say Hope Gardens? It's actually the Royal Hope Botanical Garden.
Oh, Royal. I didn't know that was a part of the name.
Neither did I until just the other day. So, girl, how you feeling?
I'm feeling great. I don't feel so tired as I did before. I feel energized, like I can just manage right throughout the day. I feel good.
Very, very good. I'm so glad you took me up on my suggestion for you to get checked out.
I'm glad I did too. You know, I remember the day when I came to your office and you were checking me and you asked me, do you have sleep issues, Maisha? And I was wondering, why would a dentist be asking me that? And you said, you need to see a sleep therapist.
Not sleep therapist, child, don't call him so. Is a specialist in airway, the pulmonologist.
Oh, I see. I see. So then I went to actually see him. And he diagnosed me with mild sleep apnea. He suggested that I got a machine, a CPAP machine. You know that machine, Doc?
Yes,
right.
yes.
So now I'm able to breathe. I can sleep longer. No longer do I sleep for 3 hours and I just jump out of my sleep. No. I sleep for probably 6-7 hours. And when I'm awake, I feel alive. I feel refreshed.
Yes. Let me tell you something. So many people have airway issues at night and they have no idea. You see them falling asleep at the stoplight, or you may see them dozing off when they're on long journeys, or just during the day, you know. They sit down for a minute, they think they're watching TV and TV starts watching them. But what a difference it makes when you're breathing properly.
Yes. I'm so glad you were able to tell me. And I'm so glad that I followed up with your advice.
I remember that quizzical look you gave me, you know.
I remember that day too.
But you know, although I can't diagnose as a dentist, there are some telltale signs in the mouth that can prompt me to suggest further investigation. So that's what we did.
Okay, could you please tell me though, what did you see on that day that would have prompted you that I may have sleep issues?
Well, one of the signs is evidence of acid erosion.
Oh.
I saw that there was evidence of grinding of your teeth. There's a little irritation on the roof of your mouth that suggests that anything in there, any air coming in might not flow freely. So you might have been snoring or having some issues with the air passing through at night. And when I looked back there, Maisha, quite frankly, I didn't see much airway space at all.
Oh.
Now, any one of those things by themselves doesn't mean much, but when you join the dots, in addition to the fact that you told me that you had morning fatigue and daytime sleepiness, all of them added up so that I felt it necessary to check it out and see. And what a good thing.
Yes. I must really thank you, though, Doc.
Listen, every so often I chuckle when I remember that story you told me about your machine.
Oh
Remember when they broke into your house?
Yes, they broke into my house in July, I think it was. And when the neighbor called to say, Maisha, they broke into your house, I was like, oh my God, what am I going to do? I no longer have the sleeping machine. I was so relieved back when I went into the house and I realized my sleeping machine was there. I was like, oh my God, thank you, God, it is still here. Because that machine is quite expensive.
Yes, and it has changed your life forever.
Yes.
It has given you a new lease on life.
That is true. I feel rested, no longer tired, and can't make it through the day. I'm pretty good now. I can make it through the day now.
Well, I'm glad you came to see me, and I'm glad we were able to talk. So I guess you're on to work now.
Yes.
All right.
Thank
Have
you so
a good
much.
one.
Bye.
Bye-bye. I am so glad that Maisha's quality of life improved so tremendously. Now, as a dentist, I certainly cannot diagnose airway issues, but I certainly can point you in the right direction. Listen, catch me next time. Facebook, YouTube, and our LFD website. See you next time on HD's Jazz.
Hello. Today we're going to be making breakfast and preparing a lunchbox for school. Let's start with some sugar and salt and wash it down with a nice big glass of more sugar. And now for the lunchbox. Let's put in saturated fat, more salt, and sugar. Foods high in salt, fats, and sugar increase the risk of hypertension, obesity, heart disease, and type 2 diabetes. Now more than ever, we have the right to know what's in our food. Give us warning labels on the front of our food packages.
We go over now to the business desk for the latest report on the financial markets. Gabriel Thompson has the details.
In Tuesday's trading session, the JSE Combined Index advanced by 1,602 points to close at under 400,000 units. Overall market activity resulted from trading in 81 stocks, of which 38 advanced, 31 declined, and 12 traded firm. The Junior Market Index declined by 25 points to close at under 3,000 units. Stocks advanced for AMG Packaging and Paper Company, Barita Investments Limited, and Caribbean Assurance Brokers Limited. Stocks declined for Access Financial Services Limited, Pbcj Jamaica Limited, and Blue Power Group. Trading firm were 1834 Investments Limited, Epley 7.5% preference shares, and Epley Limited 8.25%. Darren Trading Company Limited was the volume leader with 3.8 million units, followed by Wigton Wind Farm Limited ordinary shares with over 3 million units, and Mailpack Group Limited with 1.2 million units. In foreign exchange trading for Tuesday, March 16, the US dollar ended trading at $146.78. The Canadian dollar sold for an average $117.61. The pound sterling traded for $206.47, and the euro ended trading at $177.57. Oil slipped for a fourth day on Wednesday as concerns about weaker demand in Europe outweighed an industry report that showed U.S. crude stockpiles unexpectedly fell last week. Oil also fell after the release of the latest reports from the International Energy Agency, which said a supercycle was unlikely, demand won't return to pre-pandemic levels until 2023, and could peak earlier than previously thought. Brent crude futures fell 66 cents to $67.73 a barrel. West Texas Intermediate crude futures fell 42 cents to $64.38 a barrel. And that's it for this Wednesday edition of the Business Report Inside the News on PBCJ. I'm Gabrielle Thompson. Pleasant viewing.
We go now to stories making headlines across the region. In St. Lucia, the question is being asked, will the island get on board if the travel industry moves ahead with plans for vaccine passports? Prime Minister Alan Chastanet says the island has been readying itself to get on board with the vaccine movement. We have more in this report.
A digital vaccine passport. What does this mean for the future of travel? British Airways, which services one of St. Lucia's largest source markets, the UK, has announced the rollout of an app-based travel pass, touted as an easier way for passengers to prove they are safe to travel, having been vaccinated against COVID-19. Now, Prime Minister Alan Chastanet says St. Lucia has been readying itself to get on board with the vaccine passport movement.
Government Modernization Unit has already been working with the Ministry of Health for the last 3 weeks on creating an electronic version. So we started off with, as you know, a manual implementation and rollout of the vaccination. I'm hoping that by next week the electronic version will be done. So we will manually update the database, and it will produce an electronic file for you that you'll access online, but certainly that you can also put into your your iPhone or when you're traveling that would give you an electronic record of your vaccination.
But what of the voluntary rollout of the vaccine? How will this impact persons who are desirous of travel but have opted out of accepting the vaccine?
It was just facilitating it for those persons who do want to have it. And many persons who are going to travel are realizing that it is going to be a requirement to be able to travel. Certainly it would be much easier to travel with a vaccine than not traveling without a vaccine. We certainly want to make sure as a government that we're facilitating that process.
But does the island have a say as to whether citizens from St. Lucia will give into accepting vaccination passports as a means of travel in the future? According to Minister for Economic Development, Guy Joseph, St. Lucia will comply with the decisions taken by leading nations and global health agencies.
If you see the discussions that are taking place on the international arena about a COVID-certified passport or something to show that if you're going to travel internationally, that you can present your COVID certificate to show that you have been properly vaccinated. The world is not very clear as yet. The officials, they are not very clear as to which direction this is going to go. But I think within the next month or two, we should get a much clearer direction. Because remember, we are part of the global response to COVID. You have PAHO, you have the CDC, you have the leading countries, you have WHO. These are the people who would set what the agenda is that the rest of the world would follow.
For its part, the World Health Organization has cautioned against vaccine passports for international travel for numerous reasons, including ethical considerations surrounding equitable distribution of the vaccine globally and the length of immunity provided by licensed COVID-19 vaccines. Solange Alfred, HTS News Force.
And in sports, we bowl off with cricket. The West Indies team is still basking in their one-day international series win over Sri Lanka. Batsman Darren says he is eagerly looking forward to the upcoming test matches against the visitors. We get more in this Newsroom Guyana report.
Obviously, it's always good to get runs under your belt. It's always good to spend time out in the middle, also just before the start of a test series and stuff like that. But at the end of the day, it's a totally different format. So yes, we have a couple of days before the start of the test series, so it's important that utilize those days in the most in the best way possible before the test match starts. Criticism, I think it's part and parcel of the game, but for me, it's a situation where I don't really listen to the critics that much. More so, I only listen to the people that definitely care about me and stuff like that. Sometimes when you're not doing well, you don't hear from a lot of people, and when you happen to have a good day out in the middle, your phone is filled with messages and all the best wishes and stuff like that. So for me, to be honest, it's just a matter of listening to the people who've been there for me, through the good and bad, more so than people who just feeling to say something because they have a mouth. So for me, just trying to stay positive as much as possible, trying to learn as much as possible, and just trying to do the best for West Indies cricket.
And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.